Welcome, everyone. We are beginning our webinar. Welcome to our Green and Safe Cleaning, Why It Works and Why It Matters session. We have an excellent panel for you today. I am Elizabeth Krautscheid. I am with CHIPS. I have been here for the last 4.5 years, and I'm very pleased to have started this webinar series and to have all of the attendees joining us. Today our panel is going to cover technical perspectives on green cleaning, how to create a green cleaning plan, and what the current best practices are. And then there will be time at the end for audience questions and comments. First, I need to thank our sponsors very much, Group 14 Engineering, Healthy Schools Network, Perkins Eastman, and Into Architecture. Couple housekeeping points. Post your questions at any time in the chat. Scott, the moderator, and I will be monitoring that for you. And please keep on mute unless you're a panelist. And we will be recording and posting everything on our website. The slides have a number of links at the end, and all of that will be available for you after the session. With that, I would like to introduce Scott Case, our wonderful moderator today. Scott is Vice President of Corporate Social Responsibility and Sustainability at the National Retail Federation. In this role, he leads NRF's Sustainability Council and supports retailer efforts to use their businesses to make the world a better place for everyone. Scott has focused on the intersection of business, environmental, and social concerns since the mid-1990s. And in my conversations with him, he's very humble, but don't let that fool you. Scott founded EcoLogo, which is now part of the UL certification brands. And with that, I'm going to turn it over to Scott. Thank you.
Hey, thank you so much, Elizabeth. And kudos to you. Thank you to you for bringing us all together for this incredibly important topic. We were geeking out earlier before all the crowd showed up because the folks on this panel have been selected by Elizabeth for very specific reasons, but really all of them are advocates for green and healthy, safe cleaning. So I want to kind of emphasize that. Now I'm going to try and put them in little buckets where none of them belong. We kind of have three big perspectives, if you will. We have an industry perspective that we'll hear from Steve Ashkin. Steve is an entrepreneur, author, speaker, leader of the green cleaning movement. As I and many others have said, he's actually the father of green cleaning. It was 25 years ago, I think I first met him. He was already the green cleaning guru back then. He is currently president of the Ashkin Group, executive director of the Green Cleaning Network, co-founder of the Green Cleaning University, CEO of Sustainability Dashboard Tools, which is a very powerful software to understand sustainability initiatives. And all of those are just kind of part of his grand scheme to take over and clean the world with greener, healthier, safer cleaning chemicals. So that's Steve. We're going to hear from him first. So after that industry perspective, we're going to bounce into kind of a more EHS perspective, environmental health and safety perspective, with Lynn, who's done tons of things like putting together specifications and contracts for green cleaning. But Lynn has more than 30 years of public and nonprofit service. She's been a private consultant in the environmental health and safety field, done a lot of pollution prevention, P2 kind of work in the public sector and with small businesses. Big focus on prevention, reducing hazards in schools and the workplace. And she co-wrote the Infection Control Handbook for Schools in 2021. I told you we were going to geek out on this kind of stuff. So we've got that industry perspective from Steve, kind of the EHS procurement perspective from Len, and then we bounce over to kind of the facilities level perspective with Ken Wirtz. So Ken is the executive director for the Massachusetts Facilities Administrators Association, but probably more importantly, at least in my history, former director for the Maintenance and Operations Division for the Sharon Public Schools there in Sharon, Massachusetts. So nothing like literally getting your hands dirty to kind of understand this space. He serves on the Massachusetts School Building Authority's Design Selection Panel and the Massachusetts Department of Elementary and Secondary Education Reopening Site Support Team. So Ken, parents everywhere are happy you helped get those schools reopened and safely. So we've got those three big perspectives, the industry perspective, the kind of EHS contracts perspective, and that facilities level perspective. So with that, I'm going to shut up. I'm going to put myself on mute and start listening to these experts we have. So Steve, if you'd get us kicked off.
So thank you very much, Scott. Thank you, Lynn, and to all of you on the line today. Thank you for spending some time with us. We hope you find this to be very helpful in the work that you're doing. And as Elizabeth suggested, if you have questions, please submit them. And to make sure you understand how this works, would you do me a favor and in the chat box, just type in where you're listening in from today. So let's get you engaged. Let's make sure you're asking questions. And again, make sure that you're really finding this as valuable use of your time as absolutely possible. Next slide, please. So I'm just going to jump into stuff since I have a pretty limited amount of time and we want to make sure we have plenty of time for your questions. Foundationally, what I want to do is talk a little bit about the technical stuff. And if you think about during COVID, we started hearing a lot of words about individual vulnerabilities. You know, I don't think I ever heard the word comorbidities before COVID. But basically what we're starting to understand is that people are different, right? People have all kinds of different health issues that make them susceptible to whether it's pathogens on surfaces or other things that can harm their health, whether they're a cancer patient, whether they have diabetes, whether they have other pre-existing health conditions, whether they have respiratory issues, whether they have asthma, and on and on and on. So one of the things that we have to understand right foundationally is that people are unique and we really have to pay attention to the more vulnerable people. And among those vulnerable people, I also want to pay attention to custodians, especially because they have occupational exposure to the hazardous products and they are more at risk simply because they're using them up close and personal for many hours a day and often in what we might consider confined spaces like when you're cleaning a bathroom. So we want to really pay attention to the people and always also remember that our kids need special attention. They are not miniature adults. They really are more susceptible to what's going on in the environment. And we really do have to protect children's health. The next issue that I always think about is the routes of exposures. You know, how these hazards are going to affect people. You know, whether it's through contact or they're going to ingest something or they're going to inhale it. And part of the reason that that's important to break it apart is because that allows us to really think about how we best can protect people's health. And then the last issue has to do with the issue of hazard versus risk. So for example, if we had a pathogen, a hazardous, deadly pathogen in our bathroom, and it was on our sink faucets, and it was on the towel dispenser, it was on the soap dispenser, and while they all have the same amount of contaminants, but if you think about the process of using the bathroom and hopefully washing hands, you know, after you turn the sink faucet on and you push the soap dispenser and you get contaminants on your hand, for people who put soap on their hands, I'm going to say 100% of them will actually rinse them off. You put soap on, you're going to rinse it. Not everyone washes their hands, but those who put soap on their hands are going to rinse it. So the risk of actually getting exposure from a soap dispenser is very different from the handle of the faucet, which you have to turn off, that could be contaminated even after you wash your hands or push that knob on the towel dispenser to get a paper towel. So we need to think about not just the hazard, but also the risk so that we can make good plans on how to address people's health. Next slide, please. The most important thing I want to share with you from this slide is the definition of cleaning. You know, we spend a lot of time thinking about disinfecting, but cleaning is the process of removing contaminants from the surface. And it doesn't matter whether they're alive or dead, whether they're organic or inorganic. We need to focus on cleaning. That is really the key. If we remove the contaminants from the surface, it affects whether or not or to what degree we need to disinfect. So cleaning is the critical issue. Next slide. And one of the things that I want to sort of put out there to all of you is this concept of, if we spray disinfectant on every surface in a school, and we leave the disinfectant on the surface along with all the contaminants, alive or dead, the inorganic materials, the dust, soot, the vehicle exhaust, etc. There are plenty of things that remain on that surface, even if we've applied a disinfectant to it. And we need to really start rethinking about cleaning and the need to remove contaminants from our surfaces and not just spray disinfectant all over everything. Next slide, please. And part of this ties to the whole issue of cleaning thoroughly. So I want to sort of propose to this group that we develop a green cleaning handshake or signal. And I want everyone to do this. Rub your hands together. And you know that CDC says we should wash our hands for 20 seconds, right? And we should sing happy birthday 2 times, just like we're telling a 5-year-old, right? That's how we teach 5-year-olds to clean their hands. Sing happy birthday twice. At some point, as professionals and those who care about what's going on from a cleaning perspective, we need to make sure people understand that, if you're just doing this, your hands are still dirty, no matter how many times a day you rub your palms together for 20 seconds. We have to clean thoroughly between the fingers, individual fingers, the thumbs, the back of the hands, right? We need to use a towel. And by the way, while we're at it, let's think about hand hygiene. Let's look at our hands. Are there sores? Are there cuts on them? Are there other things we should be concerned about? Are our fingernails too long and dirty so we can't clean them? Let's stop being so superficial about what we're doing and really thinking about not just the time, but doing things effectively. Next slide, please. Because this is an issue of green cleaning, here is the actual technical definition of green cleaning. And the most important things I just want to share with all of you in this is that we're not saying that traditional products are bad. That's not what we're saying. If used correctly, with right ventilation, all these things, they're totally safe. What we really are trying to advocate for is the process of continual improvement. And the improvement isn't to make them perform better, because in the year 2021, we figured out how to make glass cleaners that clean glass. Come on. The improvement we're looking for is, can we find products that further reduce impacts on health and the environment? That's what we're trying to accomplish. It's not about bad products and good products. Let's encourage those companies and use those products that further reduce impacts on human health and the environment. There are a lot of smart people in the cleaning industry. We can make better decisions. Next slide, please. And finally, with just a couple minutes I have left, I just want to share a few of the things that I find very interesting, and that is tied to the innovation that really is happening in the cleaning industry. I'm going to suggest that while we like using the term cleaning for health, it has really become nothing at this point more than a marketing slogan. We need to put some meat around it. Currently, we clean for appearances, and schools have so little resources that our custodial staff is really struggling to get everything done. So one of the things that we're looking at is, how do we actually measure cleaning performance? How do we use technology to really decide if surfaces are clean? And how do we find other technologies that can be helpful to us, like using UVC, especially when we're trying to clean or disinfect delicate electronic components? And if you really want to improve the environmental impacts of the chemicals that you're using, look at on-site generation of chemicals. Incredible environmental savings. But more than anything, what I really want to implore all of you on the call is we've been seeing on the news these school board meetings where parents and others have been going in and yelling and screaming for the issues that they care about. And I want to encourage all of you to do some yelling and screaming to get our communities to better fund our schools, especially from an operations and maintenance perspective. We need to raise hell with people. Our people know how to clean. We know how to do these things. We need your help so that our schools have the resources to do the job that they want to do and can do. So with that, if you go to the last slide and let me thank you for the few minutes you've given me, and I'll turn it over to our next speaker.
Hi. So I want to follow that up with kind of operations perspective. I just want to be clear. So I've been working in operations departments in facilities for over 20 years and work with all departments within school districts. And I'm going to just cover some of the key questions that you would ask to develop a Cleaning for Health green cleaning plan. We don't have a lot of time, so I want to touch on some of the key things that I found that really impact how well we can design and implement a program. Next, please. So starting with who will be involved in developing, implementing, supervising, and evaluating your plan. And this will affect the outcome of your plan, who's involved. And although I'm not going to focus on the pandemic, I want to pull from some of our experience over the last year and a half of many departments now, or all departments in school districts, have started to do the cleaning and disinfecting because of what was going on in the pandemic and the limited facilities personnel that we had to do the work. So it was really important to be able to coordinate with them and to work with them to provide technical assistance to make these decisions and develop the programs. And whether or not you do it ideally together or per department, it's really important to coordinate at the administrative level. And whenever possible, to pull in custodians and union reps if your school district administration will allow that, because that will enable a better outcome. And you want to look at who will be providing the technical assistance, guidance, materials, and training, because if it's from working with the vendor, you want to make sure that any materials that they have that you can customize for your facility that include the environmental health and safety information that you want to ensure the safety of your workers and occupants. And then who is responsible for doing the cleaning and disinfecting? And this exploded this last couple of years. All the departments, many staff. And so we had to really look at that. You know, is it required? You know, with custodians, yeah, it's been required, but then it was, if it's going to be required of other staff, you're dealing with union issues. Is it prohibited? Are students allowed to disinfect? And there are regulatory issues with that. Is it voluntary? And what kind of support are you going to provide these people? So if we have thousands of people in our schools now that are doing this, the magnitude of our training and technical assistance program is totally is exponential. Next, please. So this is just a quick example. You don't need to read what's on the slide. I just want to point out what we did. As part of the Green Infection Control Guide that we just updated, will be out hot on the web in a couple of weeks, is we developed for every single department in the schools, just a worksheet so that if you're going to develop protocols for your department, you really need to look at what areas need to be cleaned and disinfected. What does that mean for what kind of equipment and products you need? And when you're developing procedures, what should you be thinking about? Because if this is not their area of expertise, providing them with guidance is really helps really target what they need to be doing. Next, please. Then what information will you be basing your plan on? Will you be doing a workloading analysis and a building assessment? And these are tools to help you understand how you're doing things now, what you have to deal with And there are a number of different tools to do this, but there are some key things that these tools will help you look at, like look at square footage. How big is your building? How many fixtures? What types of rooms are you trying to clean? What type of tasks are you trying to accomplish? And so what that does is it forms a basis to generate the information you need to develop a strategy moving forward. What equipment, products, and staffing do you need to do that? And in terms of staffing, what resources do you have available to do this? You know, are they sufficient for the level of clean that you want? And how can you ensure that if you are asking your custodial staff to do certain tasks, that you're not always pulling them away to do other things? If you don't have a framework to understand what's reasonable based on your staffing levels, to ask of these, you can continue to cut staff and add more responsibilities, but you have no framework to evaluate what that means for what they can realistically do. And so right now we're facing huge labor shortages, I know in my school districts, and how are we going to deal with that? I mean, we're really struggling right now. And so we've got added duties on top of that with the infection control. So that all needs to be accounted for in your plan. If you have a workloading analysis, it's really helped us look at, all right, this is what we have for staffing levels. And when those staffing levels are cut back, how can we adjust what we're expecting to do? What are priority cleaning tasks that need to happen? And then what resources do you have to upgrade your equipment? And some equipment actually will help you with some of that, the staffing limitations. Next. And so the what strategy will you implement? What items and surfaces will just be cleaned or cleaned and disinfected? I mean, are you cleaning walls and floors, and do you need to? And so these are really important questions in terms of both time and chemicals and exposures. And then what is the schedule and frequency of these activities? You know, we know we increased during the pandemic, and now that we know it's not contact surface, we've pulled it back. So these need to be accounted for in your plan. And then based on the what, you develop your training and guidance materials, and who will it be provided to? I mean, all of a sudden we had thousands of people doing this work. And so we really had to figure out, we had to put together work practices for them, protocols. We had to ensure that they understood the health and safety of the chemicals. And we had to train them on disease transmission. So we were really looking at, we put videos on the internet, you know, we put posters everywhere, we did quizzes. So we ensured that people really understood what they were supposed to be doing. Next, please. And then what criteria are you going to use to select products and equipment? Because ideally you want to minimize risk to workers, occupants, and the environment. So some examples are minimizing the hazard level, right? You could use third-party certified products which have already done the work for you to vet hazard level and efficacy. And minimizing number of products for us has been huge, because we've gone, like a good example is 27 products down to 7 products in food service. And we had to do less training and managing all the chemicals. And that really helped streamline what we needed to do in terms of management and what people needed to understand. And then what are the cleaning for health components of the plan, in addition to your cleaning and disinfecting activities? What are you going to do to ensure that these standards that you've decided you want are actually institutionalized? And I can say from personal experience, it's devastating when you develop and roll out a program and train everybody on it, and you have a change in administration, and that all gets, it changes. And so institutionalizing these cleaning for health components is really important moving forward. And then what are you doing to update your equipment? You can reduce particulates in the air and reduce injuries to your custodial staff, by using less microfiber mops, or just less heavy than old string mops, HEPA vacs, battery operated equipment, reduce particulates in the air. So these are just the aspects of the program where you're thinking of both the health and well-being of your custodial staff as well as the occupants. Next, please. And the how should you do these cleaning and disinfecting tasks safely? These are your work practices. And how will your products be distributed? For us, I just moved a whole warehouse full of chemicals and cleaned them out. And, I go into buildings and there's stockpiles. And we're really rethinking this, thinking about how can we streamline this? And if we want to do some of the things that Steve was saying, like having an on-site generating system, is like having a central warehouse where you can generate it and distribute it. You can have products drop shipped. It's less expensive for freight. If you have the capacity to do that, it's going to be per district. But for us, we're really trying to get a handle on streamlining the whole process and really having a handle on what's out in the buildings, what do we have in the warehouse, and looking at inventory control systems. And then how will products be dispensed to conserve resources and reduce exposures? How will products be safely stored to prevent accidents? This has got to be the biggest issue that I deal with, in that people don't understand compatibility of chemicals and created accidents waiting to happen both at the warehouse, on site. And so I do enormous amount of training trying to teach people the basic chemistry of chemicals. But if you can reduce the hazard characteristics, if you can reduce acids and bases to neutral products, a lot of that management and regulatory stuff is reduced. And then what happens when all these disinfectants that we bought and all this, sanitizers and disinfectants expire? They become hazardous waste. So you need to collect them, store them, and dispose of them. Hopefully you're monitoring this and you're preventing overbuying, but we saw with the pandemic and the panic buying, now I'm disposing of thousands of dollars of hazardous waste, from these expired products, because once a product becomes waste, a hazardous waste, a whole set of regulations kick in. Then lastly, how will you monitor and evaluate your program? Are you doing inspections? How often? Are you using software? Are you doing the kind of testing that Steve was talking about? Next. And so my last slide, I want to share with you that a lot of the work that I'm talking about now that we do in our school districts is we've actually written the guide that we've been all referring to for green infection control in schools. It is free, it is on the web. We should be uploading the new version of it in the next couple of weeks. We worked with the Toxic Use Reduction Institute over the last 15 years to fund it and fund the update and do webinars. So there's webinar material that goes much deeper into this. So our website, Inform Green Solutions with Carol Westinghouse, has a ton of free information for schools and daycares, childcares. And then the Toxic Use Reduction Institute lab has great information. So I hope you're able to follow up and take advantage of that. Thank you. Turn it over to Ken.
Nice, jump right to the end of my slide. Just so you guys know, I'm going through a horrible lightning storm right now. So if my feed drops out, Steve and Lynn, you're gonna have to take over. So hi everyone, how are you doing? Elizabeth, I believe you're on my end slide, or you can go to the next one or the other. There we go. A little comedy for you. Here's a nice picture of parent janitor conference, and the janitors reporting back to the parents that your kid throws up a lot. I think you'll see a common thread that goes through both Steve's discussion and Lynn's discussion. Green cleaning is great as long as you're supporting your custodial and your janitor staff. Without them, none of this is going to take root. None of this is going to get you to where you want to go by making your buildings safer and healthier by using certainly green cleaning products. That's the easy part. The hard part is having it be part of a system. The hard part of it is supporting your workforce that's out there doing the work on a day-to-day basis. Next slide, please. So for right or wrong, performance forever, we've always looked at it, and public perception has been it's kind of been jaded, oh, those lazy workers, oh, they just try to sneak away time, they're stealing time. So is it our culture that's put them in this position, or is it our leadership and management? I think it's the latter. Have we embraced them as professionals? Have we provided them professional development? Have we provided them training, supervision? Or have we created a culture of good enough, of the you can't see it from my house, don't worry about it? And you get a little bit of both. And, I'm fortunate enough that I get to work with about 130 different communities throughout Massachusetts here with my roles with MFAA and our membership. So you can see the schools where there's pride and ownership, where people care and where they really roll up their sleeves. And then you can see the other communities where maybe not so much. And the commonality that I've seen through that is that it's leadership. And I wouldn't even call it leadership. I'd call it management, because they're not really leading, they're managing. They're telling people, go sweep that up, versus here's why we're sweeping it up. Let's get some good training in here. Let's use the correct products, and let's make sure that we're cleaning for health and safety, because it matters. Next slide. So training, right? This is the corporate dilemma. What if we train them and spend all this money and all these resources and they leave? Well, even worse than that, what if we don't train them and they stay, right? The senior custodian who's been with you for 30 years, but you don't want to give them training because they might find a better job, but they've been doing the wrong thing right for 30 years. They've been disinfecting with ammonia for 30 years. I had one on my team. I'm like, Dave, buddy, ammonia is not a disinfectant. All you're doing is making your eyes water and potentially harming children. And why are you even using that? So again, you can't be concerned about not training. You need to train them up. Next slide, please. App is a great framework. There's a bunch of different resources out there. Steve shared some, Lynn shared some. I like app as levels of cleanliness. I think it's kind of funny to some point. Most public schools throughout the country, I would say that we're probably funded at a level 4. So from a custodial level, we're accepting moderate dinginess, which I love the terminology. Moderate dinginess is our goal. That's our bar we're setting for. And if you're a really good district, you may move up to casual inattention. Wouldn't that be awesome? Hey, parents, we're going to maintain your building at a level of casual inattention, because that's how we care about your children. So I provide this kind of as just a funny talking point, but it's really serious in the fact that none of our public schools are funded where we should be. We're just not. We're faced with always budget cuts, the budgets being too lean. And unfortunately, one of the necessary evils, or so we're portrayed as, is the custodial and maintenance end of the house, which we want to, we're told to do more with less. And if there's no framework, like Lynn had mentioned, if you don't understand how much you have to clean and what it takes to clean that appropriately, with green cleaning products, with Green Seal certified, with DFE certified, that's important, but also the labor that goes into it. How long does it take to appropriately clean desks, disinfect desks, neutral clean them, get through a classroom? On average, the usual rule of thumb is between 12 to 15 minutes per class is what's allotted for a custodian to go through a classroom and clean it. And that varies depending on the grade level. A kindergarten class where the kids are eating snacks and lunches is completely different than an AP calculus class in a high school. There's more needed, more workload for that space. So some things to consider about that. Next slide, please. And I apologize if I'm rushing, because I'm trying to talk about 500 hours worth of stuff in 10 minutes, but hopefully you'll get the idea of what we're trying to tease out here. Cleaning, versus disinfecting versus sanitizing. This seems to be the misnomer, especially during the pandemic. We have been putting more stuff on surfaces than you can read about. Teachers bringing in Lysol wipes. This one's bringing in that. Oh, you have to use bleach. Oh my God, don't worry about it. So what people don't understand is bleach is really nasty. I think people have finally understood that, kind of, even though CDC had put it out in part of their COVID guidance. But what people don't understand is that bleach has a shelf life of 24 hours once you crack the cap. So you might have a nursing staff that makes a 1 to 9 bleach mixture at the beginning of the year in a spray bottle, thinking that they're doing the right thing. After 2 or 3 days, the efficacy of that has depleted to almost zero. So now you're just spraying stinky water around your building. That's a training piece. That's an understanding of what's in your building, what's not in your building, and what you can and can't use. Process, are you using microfiber towels? Do you clean the surface first, then do you disinfect, then do you clear rinse? Or are you sanitizing in a cafeteria setting where you have to clean, then sanitize, and it's a no rinse? Oh, there's a good question. Do I think 10 to 15 minutes per classroom is sufficient? Absolutely not. 10 to 15 minutes is borderline trash and dash, which means you go in, you dump the trash, you pick up the big debris, and then you dash on to the next room. Is there a right number? It depends on the setting, depends on the classroom, depends on the preparation. 10 years ago, part of our psychology of cleaning a classroom was teachers were to have students put their chairs on their desks at the end of the day because it would save 4 minutes of time for the custodians. Now we're post-pandemic, where every night we're cleaning those desk surfaces. So we have to shift back to make sure your chairs are down so we can properly clean your desks every night. There's a lot of differences and a lot of nuances, but it's training your custodians, it's training your teachers, training your students, what works, what doesn't. Electrostatic sprayers, foggers, misters, all that kind of fun stuff out there. I've seen weed sprayers. I saw one district was using they went and got a power painter from Home Depot and they were using that to spray down disinfectant. For God's sakes, just stop. Oh my God, you're wasting product and you're endangering people. There's a place and a time for every piece of equipment that's designed. I think electrostatic sprayers are great if used as how they're intended to be used, but it comes with training. It comes with verification of the products you're putting into them. Not all products are created equal. Not all products can go through a fogger, mister, or electrostatic sprayer. So make sure that you're training your people, you're training your buying person, the person that's in charge of. Lynn had mentioned it. We rely on our sales force a lot for some of these products, and they have no idea what they're selling. They're just getting it off the shelf. So just be cautious and buyer beware. Next slide, please. Here's a good picture of a fogger, mister. I like the. So this is an electrostatic sprayer. Right, during COVID, everyone was buying them, and I think they served their purpose for what was needed. But are you cleaning the surface before you're spraying it? Are you just going down and just spraying product? Do they know? Do the people using the equipment know what PPE is required? Are you using gloves? Do you need an apron? Do you need a respirator? It depends on the device. Depends on what you're doing with it. So again, training. You need to make sure people are prepared. We had one district that was reported that the custodians were using fogger misters while the kids were still eating lunch at the cafeteria tables. And these people had received training, but I think someone gave them a directive. You need to go in there and do that because our Board of Health said you have to fog those places. Well, that's endangering the kids and endangering the person that's using it. So just make sure you're training your administration, you're training your custodians, because we've seen some things happen that really shouldn't have happened that were clearly avoidable during the pandemic. Next slide. Part of green cleaning is not just buying soap, not just buying disinfectant, not just buying healthier products. It's also part of a system. Part of CHIP's credentials for a building design is that you have adequate matting. So when you walk into the building, a good rule of thumb is 5 paces, 5 steps to clear a significant amount of debris off your shoes. Well, what does that mean? That means that you're bringing less dirt into the building. Less dirt equals less labor. Less labor provides you more ability to do some of the other cleaning that's going to help provide a healthier environment. Now with the pandemic, we're looking at air quality is a huge component. So we're changing our filters. We're putting in all sorts of different filtration devices and everything. The more dirt that you can capture off of people's shoes as they come in that front door, the better you are. Next slide. And how do you clean that carpeting? How do you clean those flooring? HEPA vacuums. Right now, the CARES Act fund, federal funds for COVID response, you can purchase new equipment. It's a great time. Get rid of those old bag beater bar brush uprights. Get some HEPA vacuums in there because that is going to impact your ability to capture some of those respirable particles in those spaces, provide a healthier classroom environment, and provide you with some ergonomic technology that's going to protect your custodians. And part of this process is explaining to people what you're doing and why. CHIPS has a good procedure that if you have a CHIPS building, this is not a huge promo for CHIPS, but why not? We're here. I like the concept that the school committee has to buy into a concept and vote in that all vacuums will be HEPA rated vacuums if you're doing a CHIPS product. I think that's kind of cool. I think that pushes the envelope towards green cleaning. And again, it's another piece of the puzzle. It's not just buying product, it's also buying into the concept of improving your process to make a healthier building. Next. And that's it. Anyone has any questions, you can certainly reach out to me, but I think we're going to turn it over for Q&A now. So I'll give it back to Scott.
Hey, thank you very much. Oof, I don't know about the rest of you, but my ears are almost exhausted, like so much information coming at us. So real quick, I do want to thank folks. A few people did email me a question or two. So I've got some questions there. But Elizabeth, this is your party. So I want to make sure you have the honor of asking the very first question if you've got one. And if not, I certainly have a couple here on my end.
Well, thank you for that, Scott. I'd be happy to kick us off. So these came in ahead of time, and I really like this one for the panel. What are your thoughts on students doing cleaning?
And why don't we go in the order that they were presented? So Steve, feel free to answer or pass to Lynn and then to Ken.
Certainly. Personally, I love having kids doing some cleaning. I love it. There's nothing more valuable than teaching our children that they should pick up after themselves. But with saying that, I don't want kids stripping and recoating a floor. I don't want them disinfecting a bathroom. So, but there are things, as Ken talked about, that kids can do, such as picking up pieces of paper and crayons and stuff on the floor and just organizing things, that there really are things that they can do that not only teaches a valuable life lesson to them, but also really can free up our custodians for doing the work that they alone should be taking care of.
Thank you. Lynn, do you want to add anything to that?
Yeah, sure. We struggled with this. So I have one of my school districts has 62 facilities. We just didn't have the labor, the custodial labor to be able to go in between classes to clean desks. And, there was like enormous amount of pressure to clean desks, and we had to really look at, where do you really need to clean them? In elementary school, they're sitting there all day. So can you wait and clean them at the end of the day? With middle and high school, when we thought it was contact transmission, it was a really big deal in middle and high school. And I would not allow them to use disinfectants. It's regulatory, we shouldn't do it. And so we had to really look at, I really don't like wipes, but there wasn't time to spray down the desks and wipe them with the microfiber. Middle and high school don't have sinks, where elementary schools typically have sinks, but there just isn't the time. So could the teachers spray and the students wipe, but then the students need to wash their hands. So it was a real challenge, and we ended up with cleaning wipes, which was not ideal, but there was the need at the time.
Thank you, Lynn. Ken, do you have anything to add to that, or should we move to the next question?
I can add to it really, really quickly. I think we were all faced with the same thing of what is the best we can do with what we have. There was no right answer during COVID. We're not post-COVID yet, but there's still no right answer. So the question is, what can we do that's going to minimize the amount of risk? And like Lynn had mentioned, we worked really closely with Churi. We were really close to the Department of Public Health to try and figure out what that solution was. And it varied from age group. So kindergarten is picking pencils up off the ground. I think it's awesome. Put away the books at the end of the day. Super. All this stuff is great. As you get older, you can transition into kids being brought in as part of the team. Kids, I've got 2 teenagers, and I think anyone that has kids on this call realize how well kids do when they're given a directive. You will go clean up this floor. Yeah, go pound sand. Not going to happen. Versus, hey, if you guys can help by picking up pencils, you're going to allow our custodians to make sure everyone in the building is healthier and safer. You're part of the team. You're part of the reason we're able to reopen schools. Can you give us a hand? And you communicate that out to the parents and to the kids, and you're more apt to be successful if you make them part of the solution versus just being the typical top-down, just go and do this. We had some good results. I will just say, just be cautious. I always freak out about site cleanup outside, picking up piece of paper where we're used to that kind of stuff. With the opioid epidemic, there is a possibility of overdosing just by touching things outside. Not to freak people out, but if you're going to do a playground cleanup or that kind of stuff, I always take a chance to plug that PPE, PPE, PPE.
Very cool. Thank you, all three. So Elizabeth, I know you got a couple of questions in advance. I have two really good ones here. I think one of them's likely on your list. You want to give your next question and then I'll throw one out there?
No, go ahead, Scott. You take yours.
Well, very cool. Then I'm gonna start with the mean one. So this is a heads up to our three panelists that I'm going to start with the mean question. And because I know Steve best, I'm going to him first, and then I'll let Steve decide who goes next. So here's the question, and I'm going to paraphrase a little bit. Basically, all three of you talked about the importance of institutionalizing really good practices. But all three of you kind of said it's important to do it and moved on to some of the chemical pieces or the cleaning pieces or the measurement pieces. Here's the question. Give us one good example of how a school actually institutionalized the best cleaning practices. So give an example of how a school successfully institutionalized these healthier, greener cleaning practices. So we'll start with Steve, and then Steve can decide who goes next. Steve?
Well, you know, over the 30 years that I've been working on green cleaning, we've done this with schools all across the country. And frankly, I'm doing international work and working with them as well. And, you know, things always start with a policy at the top, right? And then it rolls into what we're buying, and procurement these days has become relatively easy because of third-party certifications, makes it easy for procurement people to buy it. And then obviously, you know, the training and those kind of issues within the schools to get people to do it. But at the end of the day, the thing that I found to be most important is the principal. You know, getting a principal really engaged, helping them understand what's going on, getting their buy-in, because in most schools, you know, the principal really does control what goes on and can be extremely influential in terms of what actually is going to get done in their building. So the main thing that I want to share in the short amount of time I have is, you know, let's really take them very seriously, make sure we give them the information they need, make sure they appreciate how important it is to accomplishing the major task, which is educating our children, you know, managing resources, et cetera. So the one thing that I just really want to bring out is the important role that principals have to institutionalizing the program in individual schools. And then it builds up obviously from there throughout the district. So I'm going to pass it then to Lynn. Why don't you go ahead?
Thanks. Yeah, thank you. So we found, because I've been down this road where when you didn't institutionalize it, so we created procurement policy with those standards, like what level of toxicity. We have a checklist, what, you know, if you have something that's not within that screen, you have to document things. And so part of that's one piece of it, is having some standards as part of a policy. But the other part is a portal for where all those decisions, those procurement decisions are going through. So somebody can vet them for hazard level, for need, for all those things. And those are the kind of tools. And we do that at the district level. And then it goes down to the school building level. And that may vary per district or per state. For us, the district level is where we do that work, because that's where we buy, and we don't allow them to buy anything that the district, because of contracts and all that. So anyway, working through at the district level, having that portal and having standards to become institutionalized. And I'm not saying there aren't some rogue things that we end up dealing with, particularly during the pandemic, but that is helped by streamlining what we're getting so that we get more of a handle of what's out in the buildings. Because my experience is, though, although the principal may, you know, have control over what the custodian does, they don't really know the chemicals that are in their building and what the custodians are doing with it. And that's where we feel really responsible for that, that level of it.
Thank you, Lynn. So we've got the principal level, the district level. Ken, what's your perspective?
So it's funny, I'm coming at this from a little bit of a different angle. I think the question creates a bigger question. I think institutionalizing it with the right people and the right motivation and the right energy isn't as hard as sustaining it. If you have the right people driving it, everyone's going to buy into cleaning and cleaning for healthier and making the environment healthier. The thing that's consistent in schools is school committees get voted out, PTOs, children graduate, superintendents leave, facilities directors leave. So you could have the best intentions and have everything set up and structured, but if the people that built it aren't there to carry it along, it falls apart really quickly. So I think a good implementation requires even more marketing, branding, buy-in from the students, buy-in from everyone. So that way, when those key players move on, and they do, that the next people coming through know this is what we do. This is what we're all about. This is, this is whatever, this is the pride of our schools is part of our cleaning. And then it's truly institutionalized. And I haven't seen a lot of people able to really dig in and get that done that well just yet to sustain it.
Very cool. Thank you, Ken. I heard at an ISSA conference once, creating a culture of clean. And I think that, culture trumps all these other things. That kind of feeds upon itself.
Absolutely.
Elizabeth, do you have a question?
No, we are sorry, Lynn, we are technically out of time.
Okay,
And
sure.
so I'm willing to keep the webinar going if our panelists are willing to stay on for a couple more minutes and address one more question. Otherwise, we can end it and I can try to get written responses to these questions and email them out to everybody. So panelists, do you want to put in 2 more minutes or do you want to call it a good session?
I'm good on time. I can stick around.
Okay.
So let me throw one quick question. It'll be a rapid response question that falls in the mean category. And I'm going to go Ken, Len, Steve. Ken, Len, Steve. Here's the rapid fire mean question. You all shared tons and tons of content. In 10 words or less, 10 words or less, what is the key takeaway you want people to remember from your presentation? So we'll go Ken, Len, Steve, 10 words or less. What is the key takeaway message you want folks to remember from your presentation?
All right, so 10 words or less. So green cleaning doesn't cost more. The products do work. How's that?
Very cool. And I think you have 1 extra word. So we'll pass the 1 extra word into the pot.
All
So
right,
Len,
I'll give the next person my word. Yes.
Len, you can go up to 11 words.
So
That's 1.
Stakeholder buy-in and participation and buy-in.
Participation and buy-in. Wow, you just left a lot of words on the table for Steve, but I like it. Steve?
Money, 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 money. For those of you who really care about our schools, get your butts to school board meetings, speak out, shout and scream. Let's stop making excuses. Let's stop the stuff about do more with less. If we're going to support our kids, support our schools, we need to put our money where our mouth is. More than 10 words, but we know how to do this. Come on, let's do it.
Very cool. So let me wrap up real fast and I'll give it to Elizabeth to officially pronounce us finished. One, thank you to all 3 of our presenters. You folks are absolutely amazing. The fact that you could even try and condense, 30 plus years of experience into a few PowerPoint slides, it's always impressive. All 3 of them have great information. Please reach out. So 1, thank you to each of the 3 of you for sharing your expertise. I leave you with a request before I hand it to Elizabeth. The request is of everybody in the audience. This is a trick that Steve taught me years ago. Please, next time you're out in a public facility and you actually see someone who is there protecting our health, who's cleaning the bathroom, who's sweeping the floors, who's wiping stuff down, please look them in the eye and thank them for keeping us safe. Elizabeth?
That's a wonderful parting sentence. I'm almost embarrassed to go after that. Thank you all, everyone. Thank you so much, Scott. You were a phenomenal moderator. I like to joke a little bit that when I invite panelists to do these sessions, I make frenemies out of them, because on the one hand, it's so great to have these sessions. On the other hand, it's really hard to condense 30 years of experience into 10 minutes. So thank you all for that effort. The last slide in the deck that everyone will be getting a copy of does have some of these resources here, so feel free to avail yourselves of them. And thank you so much to all our audience for attending today. We're really glad you joined us.
Thanks, everyone.
Bye, everyone.
Thanks,
Take care.
everyone.
Have a
Be
good
well,
weekend.
stay safe. Take care.